Well, good morning, everybody. I'm Alex Salaticky. I'm a spine surgeon here in Steamboat Springs, Colorado with Steamboat Orthopedic and Spine Institute. Wanted to talk to you today about the TOPS lumbar total facet joint replacement system. So there's a lot of problems that we see in the lumbar spine in particular that even today our best known solution is to do a spinal fusion surgery where we take out parts of the bone that are compressing the nerves, and then we have to stabilize the spine by putting in screws and rods to cause a fusion to happen. And as many patients know, fusion is not ideal because it takes away the motion of that treated segment and it puts force on other segments in the spine, and that can require additional fusion surgeries. On top of that, the recovery from a spinal fusion is fairly long, typically about 3 months of avoiding activities like mountain biking, like you see behind me. And so there can be a longer recovery, and then even return to full activity can be limited when your spine is less mobile than it was before. There's a newer technology out now which has been approved for use in the United States called the TOPS total facet joint replacement. What that is essentially a decompression operation in the low back where when patients have a lot of overgrowth or disease of what's called the facet joints, those need to be removed in order to get pressure off the spinal nerves. Until this point, once we've done that type of work, we're obligated to do a fusion because we've destabilized that segment and we have to fuse it so that those vertebrae don't shift. But with the TOPS device, we can stabilize that spinal segment, but it's a mobile joint. It essentially mimics the function of the facet joint. So after a TOPS surgery, the patient still has mobility through that lumbar segment, and it's not fused, and so that really offers a lot of benefits to the patient. Number one, the recovery tends to be much shorter. With the TOPS surgery, I can let people back to full activities as early as 4 to 6 weeks rather than 3 months. So again, like you see behind me, people that have had a TOPS operation are free to go back and get on their mountain bike or go hiking and do those kind of things. The other benefits, of course, are that it's not fused, so that segment doesn't get stiff, it doesn't put forces on the adjacent segments, and the theory and the hope would then be that those patients don't undergo additional breakdown of additional levels and need more surgery down the road. So while it is a relatively new technology, it's been around and approved in the United States for about 2 years. I've taken to this technique and this technology, and the patients that I've treated for it have been very happy, back to full activity and full workout regimens and everything with really no restrictions pretty early on. And I've seen some really fantastic results from it. So it's another one of those elements that we have in our tool bag now to be able to offer patients an option that's not a spinal fusion, to get them back out on the mountain, back out to surfing or skiing or whatever it is that you do. That's really what we're here for in Steamboat and at Steamboat Orthopedics, is to get people back out to their activities. Like our website says, we're here to keep you out there. And this TOPS device is another way that we can do that. So always encourage patients, when you've been told you need a spinal fusion, press your surgeon on that to really think about why that needs to be done. And if you can't get a straight answer, let me know. I'm happy to give a consult and let you know if the TOPS procedure might be a good option for you.